Health Ministry seeks to procure 70 ambulances for a supplementary budget for effective service delivery. The Truth Commission extends its deadline submission of the final report and recommendations to the Presidency on its findings. And as the third wave of the COVID pandemic hits, Gambia Red Cross Society renews commitment in the fight against the virus. These and more coming on Gambia 24. Do stay tuned. Good evening, viewers. You're watching Gambia 24 here on Africa TV with me, Sohna Tunkara, and now to our news in detail. During the adjournment debate on the supplementary appropriation bill, the Ministry of Health made a request to pave the procurement of nearly 100 ambulances for health facilities across the country. And according to the Health Minister, the mobility package will complement the sector in its referral errands to address such cases as maternal mortality. Details of that in this report.
The country's health sector has been facing numerous challenges despite being one of the national priorities in sectoral budget appropriation. The confrontation is reflected in the lack of basic medical facilities, including ambulances in different health facilities across regions. It is widely reported that the rate of maternal deaths is alarming, with instances of lack of access to health care at the right time. Certain communities rely on traditional means of transport in the form of donkey carts to ferry women and children to health centers in times of emergency. This leaves patients closer to death given the nature of road conditions and distances to cover before meeting a medical doctor. With 70 ambulances, Health Minister Ahmadulamin Samate noted the gravity of the health disaster will be suppressed.
These are the realities. Now, in Southern Combo here, a gentleman working in Banjul, the wife said to him she was feeling labor pains. The man said, wait for me, don't move an inch, I'm coming. Entered the traffic, 2 hours to get to the village. They tried to look for a taxi to hire. Before they go to a health facility, the woman died. So this has a direct bearing on maternal mortality reduction. It has a direct bearing on infant mortality reduction and on the survival of the citizenry of this country.
He told lawmakers in Banjul that his request for mobility is a mere amplification of the demand of the people.
The request actually has been coming from the communities and from your own honorable selves with regards to challenges that your constituents have been having in getting to health facilities. Building a health facility that looks like a hotel is one thing, but people getting to that facility is also a very important step. How do they get to those facilities without ambulances? I'm sure the honorable members, you ferry more people to the facilities than any citizen in this country with your vehicles, because when they have challenges, they run to you. We've all been doing that, women delivering in vehicles. It is a big challenge and it's not sustainable.
Lawmakers are likely to approve the call for support to the trying health sector, but not without a debate on availability of funds in government coffers. The demand by the health sector amounts to $134 million from a $1.7 billion supplementary budget request brought forward before the National Assembly by the Minister of Finance, would aim to fill gaps that could not be created by the 2021 national budget. Reporting for iAfrica News, I am Mariama Cham.
Minister Samata seeks for additional 70 ambulances for the effective work of his sector. Now the Truth, Reconciliation and Reparations Commission has pushed further the date for submission of the final report and recommendations to the Presidency. Following the conclusion of public hearings in May, the task was scheduled for the 30th July until Wednesday, when the latest date for submission of the report was shifted to the end of September. The extension, according to the chairman of the TRRC, was informed by the TRRC in processing 16 volumes of the report. Amindao tells us more.
Among the key dates at the corridor of the TRRC Commission was the conclusion of the public hearings on 28 May 2021, after 393 testimonies on the human rights violations under the regime of the former president. The Commission was now expected to deliver the 16-volume report together with recommendations to the Office of the President on July 30th, but the report writers are still overwhelmed with the processing of documents. As a result, 8 more weeks, making it to 30th September of 2021, is required to complete the task ahead, according to Dr. Lamin J. Cisse, chairman of the TRRC.
Notwithstanding the heavy schedule of work devoted to completing the draft report, the Commission informed the Attorney General on 27 July that it needed more time, about 8 weeks, to complete all 16 volumes of the report and other important documents. Accordingly, and following a meeting between the chairman of the Commission and the Attorney General, Minister of Justice, the Commission suggested a new date of Thursday, 30 September 2021, as the date of submission of the final report of the TRRC to the President.
He outlined the work that justifies the need for extension period of the life of the TRRC.
The work to be continued during the 8-week extension period involves the finalization of the following: 16 volumes, each containing overview, findings, and recommendations on the following: A, soldiers with a difference; B, 11 November 1994 extrajudicial killings of security officers; unlawful killing of former Finance Minister Usman Koro Sise; the convoy of the President, accidents and deaths; April 10 and 11, 2000 student demonstrations; attacks on freedom of expression and the media; attacks on religious freedoms; the junglers; unlawful killings, tortures, and human rights violations; the Presidential Alternative Treatment HIV/AIDS program; sexual and gender-based violence; President witch hunt exercise; enforced disappearances; killing of West African migrants; and the 3 institutional hearings.
The 16 volumes include transcripts of the public hearings, outreach engagement activities, and witness poetry album. For iAfrica News, I am Aminau.
TRRC extends deadline for submission of its report. Now to some COVID-19 news. The Secretary General of the Gambia Red Cross Society has expressed preparedness of the humanitarian organization for the 3rd wave of the coronavirus global pandemic. Alassane Senghor was speaking to iAfrica in the wake of renewed public consciousness on the dangers posed by the virus in its new trends. And the government has since last week announced the launching of the Johnson & Johnson vaccine, in addition to the revival of preventive measures. DCC has the list of that.
Although businesses have reopened and restrictions eased in the Gambia, the resurgence of the coronavirus cases in the 3rd wave is a matter for public attention. The 3rd wave of COVID-19 bears the fingerprints of the Delta variant, according to health officials, which has been identified in 19 countries across the world. Secretary General of the Gambia Red Cross Society, Alassane Senghor, said the situation has compelled the Gambian-based international organization to double up efforts in responding to COVID-19.
We have never stopped our operations since the beginning of the response since 2020, early 2020. We continued. What we have done with the surge increase in the number of cases, what is being considered the 3rd wave, we have scaled up our efforts. We scaled up our work in terms of the preventive measures, in terms of sensitizing the communities and also helping communities to also take care of themselves in terms of use of face mask, sanitizing or washing hands, and also understanding the need for social distancing. So we've scaled up that work.
Right from the outbreak of the pandemic, the Red Cross has been in the forefront, battling back the spread of COVID-19. Its role in disinfecting public institutions, including schools, had paved the way for a safe back-to-school period across the country. Similarly, Red Cross volunteers had been responsible for execution of various services of patients who died of COVID-19. As Mr. Senghor explained, however, the barrier protocol from the World Health Organization has positioned the Red Cross to empower families who desire to do the burials of their loved ones by themselves.
The protocols for managing the death from COVID has changed. It changed actually late last year or mid last year when WHO changed the protocols from Red Cross actively doing the burial to disinfecting the bodies and then handing them over to the families to do the burial. Notwithstanding, in the event that families feel that they can't do it for obvious reasons, our teams will always do. So we have not been doing the burials. Mainly in some very rare cases where families want us to help, we will help.
Proper equipment and resources are highly needed to enable a proper and timely response on all COVID-related emergencies on the side of the Gambia Red Cross.
One of the challenges that we face and other institutions, including governments, have faced is the lack of resources to be able to respond adequately. But for us, and like I said earlier on, that's why we have been in communication with our parent body in Geneva and to support and give more resources so that we are able to respond adequately to the needs of the response in Gambia.
The increase in the number of COVID-19 cases and deaths in the Gambia has overwhelmed both the Ministry of Health and the Red Cross Society, a situation for which Mr. Senghor urged for cooperation of all stakeholders, including the public. The Gambia has recorded an overall total of 7,333 COVID-19 cases, out of which 6,205 have recovered and 208 have died since the confirmation of the first case in March 2020. Across Africa, COVID-19 cases are surging by 20% on a weekly basis. The situation is quickly approaching numbers documented during the peak of the first wave in July 2020. The number of coronavirus cases and the resulting death toll, according to officials, will continue to rise in countries that are unable to suppress the virus and conduct comprehensive vaccination campaigns. Reporting for iAfrica News, I am Daisy Sise.
From the report on COVID-19 update by Ndai Sise, we will take a short commercial break and return with our remaining story on Gurgimbob's reinstatement. Don't go away.
The locations, the design, the materials used, all the way down to the latest details, are few of many things that we focused on when we envisioned the airport residency. As proud innovators of community estates, the airport residency in Old Yundum, a project by Swami India International, offers unique gated community with 3- and 4-bedroom villas and duplexes. Just 5 minutes away from the Banjul International Airport. Luxury, convenience, and accessibility are some of the reasons you should consider this great housing opportunity. With a clubhouse, a playground, access roads, and parking facilities available for your dream home or a valuable investment, you will find all you need at Airport Residency here in Old Yundum.
Welcome back. You're still watching Gambia 24, and now to our remaining story. Anti-crime head Gurgim Boob has been reinstated into office after over 10 months of suspension from the armed unit of the Gambia Police Force. His dismissal as head of the anti-crime followed public outcry over police brutality and subsequent condemnation of his leadership by the National Human Rights Commission. The ACC engaged cross-sections of the public on Gurgim Boob's reinstatement to the tough job.
One Mohamed Job welcomed his reappointment on the belief that the country needed someone like Gurgim Boob to combat crime rate.
Man, they anyway because the community needs security.
I appreciate Gurgim Boob's work because this country needs security. It needs people who know the towns very well. And for Gurgim Boob, he knows this country very well, especially Serekunda here. Him and Landin Boya, they know Serekunda very well. And the way things are, we need someone who knows the country very well, because nowadays thieves are all over the country. Breaking into people's houses is very common now. This is why people are even so scared to go out because of the thieves.
More than 20.
From the views of Dudunjai, anti-crime in itself is a good security unit, but the manner in which it operates needs to be properly defined and according to standards.
Why no operate modest? Because
I support anti-crime 100%, but the way they operate is lacking, because I know so many things that is going out there. For Gurgim Boob, I have no problem with his reinstatement, but I know what happened to him before. He would not allow that to happen again. He needs to check himself properly. Human beings are so important, so if you walk in with them and they do something wrong, you can arrest them, but do not take the law into your own hands.
On the opposite side, Yankuba Toure maintained that the work of Mr. Mboob has never been good since the start of the anti-crime operations in the country.
Correct, is 0.0 for next minute.
Gurgim Boob's work is not right. Nothing is good about it. All is poor. If he walks today, next day all is mixed up. What is not supposed to be done should not be done. Nobody should come and try to put out their own laws. The laws that the government has put in place, let all go by that. But if you put down your own laws, you are only trying to destroy this country.
Lawyer Martin believes that the reinstatement of Gurgim Boob as commander of anti-crime is another expansion for the country. If only he could add more force in tackling the crime rate in the Gambia.
Now, bringing him back to what they call the anti-crime unit, it becomes another development. However, for some of us, what we are after is to make sure that the current policing system to be smart and also to be effective. So if the police feel that since his transfer they have a problem or there was a gap, now bring him in, probably we will have to watch wait and see again. But it may be also somehow a good development if at all he was in the judgment of the police that he is doing a good job like compared to before. So taking it as it is, as I say, as long as he can come and add more weight into make sure that we tackle crime in our communities, especially within the anti-crime and KMC regions.
Since the demotion of Gurgim Boob as anti-crime head, increase in crime has been a concern for citizens, causing many to doubt the capability of the country's security apparatus. This has led to the introduction of Operation Zero Crime, with the view to curb crimes in the country and ensure public trust and safety. The anti-crime unit, established in April 2018, is mandated to combat crime and criminal activities in the country. Reporting for iAfrica News, I am Daisy.
With that story on Gurgim Boob's reinstatement by Daisy ends tonight's Gambia 24. Thanks for the pleasure of your company. I am Sana Tunkara. Good evening.